There's been a lot of news on the medical front this week, and we decided to ask an expert to help us sort out some of the big headlines. Dr. Assil Saleh is board certified in rheumatology and holds a master's in public health. She practices at Foxhall Internists, and no doubt if you watch the show, you've seen Dr. Saleh guest several times. Good to see you again.
Great to see you again.
Well,
awesome.
First we want to talk about this diagnosis for Venus Williams. I mean, who is more active and fit than Venus Williams? But now diagnosis of Sjogren's. Tell us what that is exactly.
Absolutely. Sjogren's is an autoimmune condition. It falls in the family of autoimmune disorders such as lupus and rheumatoid arthritis. It's not a very common disease. It can affect up to 3 to 4% of the population, particularly women. Most autoimmune disorders affect more women than men. 9 out of 10 are women. Yeah. So it really doesn't matter how physically fit you are. You can be predisposed to this condition if you have family history of autoimmune disease, or it can come out of the blue, really.
How in the world was she able to compete at this level? Because some of the symptoms, right, fatigue, is that right?
Absolutely.
How would a person be able to carry on without knowing something is wrong maybe, but not exactly what it is, and to continue to compete?
Exactly. Well, if I'm to tell you a little bit more about Sjogren's, it can affect the joints, it can affect the saliva, so people are not producing as much saliva or tears, but one of the most devastating symptoms is fatigue and pain, chronic pain or fibromyalgia. So Venus has two things going for her. She's a woman, and women typically have a higher threshold for pain than men, but she's actually very physically fit, and that can allow her to participate in physical exercise and activity.
Will it cut her career short?
There's no way to predict. I think that she'll do very well. It's a chronic condition. Venus, as well as any other patients with Sjogren's, have to be under the care of a specialist, such as a rheumatologist, and continue to get medical monitoring and testing. But it's very difficult to predict how it will affect her career.
We wish her well.
We do,
I think of the times where she probably felt like she was just not doing her best, and when it probably was this syndrome, Sjogren's syndrome. So I appreciate talking about that. I want to also get to this recent study on the mortality rate. And the new study showed that the United States infant mortality rate is higher than most developed countries and even some still developing nations. How is this possible?
Well, this is a very interesting report that was released by the World Health Organization. And it is not to underestimate that the U.S., as well as globally, we have made great strides in improving infant mortality rate, and that is death of babies up to the age of 4 weeks. It is, though, this report brings out the point that although we have made progress, it has not been as great as other developed countries.
Right.
Yeah.
Well, now, what would be the leading causes of infant mortality?
Well, in the U.S., premature birth, preterm labor is the biggest cause, but also rise in prevalence of obesity, access to health care, disparities in access to health care is a very important one. And that highlights also how health care is doing in general in this country.
How do we level the playing field? How do we get those numbers to go the other way?
Well, we have to be able to educate our women, educate any pregnant woman that it is important to get access to health care and early access to health care. Very important to continue to be well nourished throughout the pregnancy, to take the vitamins, and to have an advocate for pregnancy. As you are pregnant, it is important to have a social support system as well as an advocate for your health.
Right.
In order to have good outcomes.
Ideally, you are your own advocate, but often that does not happen, I would imagine. Dr. Assil Saleh, rheumatologist and friend of the show, also practices at Foxhall Internists. Thanks. Nice to see you again.
Great to see you again, Allison.